Frampton, the editor of Clinical Services Journal. I'm reporting from IDSc here today. I'm joined by Trevor Garcia, who's IDSc's National Chairman. Trevor, thanks for joining me today. We've had some really interesting discussion points this morning. I wondered if you could just share some of the take-home messages from the programme this morning.
Yeah, sure. Thanks, Louise, for the invite. This morning, I think one of the main take-home points was that regarding incidents that happen within the decontamination process, like contaminated instruments, there's very clearly no national way of reporting them. Each individual organisation reports their own way, and therefore there's not an overview of how big a problem it is. And certainly even in this afternoon session, there was a very strong vote for an actual national database to be set up. So that will be an interesting one we will take up with the MHRA to take forward. The second point from this morning was very much around trying to encourage people into the education of our members and of people within our industry. The difficulty is we are an unknown service. Many people do not even know we exist, and it's trying to get our profile raised more. So those are the main take-home points from today.
Excellent. Now, why is it so important to standardise on the name of departments and also job roles? That's something that was brought up on the session this morning. I wonder if you could tell us a bit more about that.
So one of the things we were looking at is decontamination units. We have a list of, I think, 12 different names that departments are called: HSDU, SSD, CSSD, all different names. They're all historical, all related to what we used to do. And my view and our board's view is very much that we should now be using a common name. That having a common name will enable people to understand what we do. So we are looking to use the word decontamination unit as a common name, and then within that there will be a sterile services department and an endoscopy unit. If you look at something like pathology, then everybody knows pathology, but within pathology you have microbiology, hematology, chemistry, numerous other sub-specialities within it. But if you're looking for the pathology department, you'll go to a pathology department. So what we're trying to do is now create in all the future documentation that's produced will have reference to a decontamination unit. And then then we can start selling out and making better known what we actually do.
So what can we do to make it a more attractive career path, do you think?
I think we need to, there's two elements. One is, I think if you went into schools now, into people in a couple of years from leaving school, and if you talked about perhaps pathology, audiology, which is a healthcare science, and many of the other healthcare science, people will have some understanding of what they're doing. If you talk about decontamination sciences, they won't know.
Yeah.
So we are going to have to, as an industry, we're going to have to start putting a profile out much higher. One of the things I used to do when I was a decontamination manager, I went into schools and I talked to children who were coming to the end of looking to make decisions what they're doing, took all the medical devices with me, showed them what we were doing, and they were, the more gruesome it was, the happier they were. So it's trying to make it attractive and actually make it knowledgeable that people know that this exists, and this vital service that we do to ensure patient safety is essential. And if we don't do our job properly, then hospitals stop operating, which we can't have.
So how would you sell a career in decontamination to the future of generation?
I think,
how do we attract that young blood?
I think there's one or two things. I mean, I came in, we asked a question this morning, how many people in the audience had started with decontamination, to be in decontamination from when they left school? And the answer was 0. None of us left school with that thought in our head. I came from retail, so something completely different, got into it by accident. I think it's one of those industries that the more you learn, the more you want to learn, and the more you learn a bit more, then there's even more to learn. The complexity of the medical devices we process have become more and more complex with the robotic instruments. We've now got 3D printing devices coming out, and therefore you never stop learning. I've done this 40 years now, and I'm still learning, so you never stop. So it is an exciting field for people. I would encourage them to do it, but you have to learn from the floor up. The other thing I would love to see in place was I was started as a trainee manager. I'd had previous management experience, but I didn't know technically what to do, so I started as a trainee manager, so I learnt on the floor, but then also did the management side, and I think that's a really good place to be. And I'd love to see that role back in nearly every department now.
So as an organisation, IDSc are doing a lot to support education, aren't you? Perhaps you could tell us a little bit about some of the things that you've put in place and that's happening now.
So with education, we run our own IDSc technical certificate, which is aimed for team leaders and supervisors. And within the next 3 or 4 months, we will have an endoscopy technical certificate. So it is a level 3 qualification in England and level 6 in Scotland. So it's available across the 4 nations. In England, there's the apprenticeship scheme for apprentice decontamination technicians, and also up to a level 4, which is the first year of a degree course level, and that is really production managers or very high level senior managers. So we're supporting it, we are working really hard to do it, and we are now working to develop a BSc as well for the managers to undertake. So we're promoting it. Hard work, but we're trying to do it. The second thing we're trying to do is work now with the Academy for Healthcare Science, who are working with us to produce registers for people.
Right.
So we will, I believe within the next few years, all of our members above a certain level will have to be registered. And with that, with a healthcare professional, so you are a healthcare scientist and you work within your realms of responsibility for that role, and you adhere to the standards.
So why is it so important to be registered? That was something that was mentioned this morning.
Why? It raises the profile of the service completely. It puts us on an equal standing with all healthcare science, which is where we should be. We are just as important as any other department. If we stop working, then hospitals shut down within a couple of hours. So it is about raising the profile. So I believe the registration is twofold. One, it enables the people themselves to have some security around they're working within good scientific practice and they have a body supporting them, and I think it allows us to sit at the table with other healthcare scientists. So I will be sitting at the same table along with every other healthcare scientist, 56 different specialities.
Just one final question. What's your hopes for the future for the decontamination sector?
My hopes for the future is that we are at every single member of every single organisation at board level understands what we do, understands the department, understands the essential service we provide, and understand the contribution to patient safety that we do in our work, and do not see us, or do not see us, they see us as an essential service, exactly as with any other healthcare science group.
Fantastic. Some really good points there. Thank you so much for joining us today. It's been a pleasure meeting you.
Thank you, Louise.
Thank you.
Thanks for the opportunity.